Hi everyone, this is Miss D. Welcome back to my video. It's been a while because I've been very busy, but I'm back. Anyway, I want to do a second video. It's going to be very short on trachs, okay? I want to come back and add something that I told you I was going to come back with. Remember I told you that I work with children, peds. And I told you that some children are off of the ventilator during the day. Now, when they are off the ventilator during the day, they have a piece that is called a HME. Okay, it goes over their trach because they're off the ventilator during the day, but they go back on the ventilator during the night. Okay, and this is an HME. If you can see it, see right here, it's an HME. And it opens up. Look, see how it's opened up right there, and you can see that little hole. Well, the HME is connected to their trach. I want you to see this now, okay? Hold on. Here it is. This is the trach. It's in their throat. See, this is in their throat, and this is how it looks in the front. And you close this down, okay? See how that is? And you can suction them with this HME on, okay? All you have to do is flip it open, just like that, and you suction right here. And the suction catheter that you're going to use, remember, it's going to be the one that you have to change each time you use it, okay? And it's this little one here. Hold on. It's this little one here. You could only, just say for instance, he needs suctioning, okay? You're going to get this one. It comes in a little pack. All right? It comes with gloves, and it has a little tiny box that you put your water in. You take his trach, you flip that little opening up, and you go straight in here. Hold on, let me see. And you go straight in there, and you can suction him. Okay? Holding this down, this is connected to the suction canister, and you suction him. You could do it, okay? You did it once, maybe you need to do it again. So you go in it again. Oh, he needs one more, so you go in it again, okay? And you suction him, all right? Each time you suction it, so if you suction him, all right, that little box that has the water, you put this in there, and you rinse it. Go back in it again, come back, rinse it, again, rinse it. He should be clear. Close this up, and then you take this one and you throw it away, okay? So then the next time you have to get a brand new one. Now, like I said, some children are off the ventilator during the day. They can have a cuff, okay? And sometimes they don't even have to have a cuff, but they'll have the HME. And that's to keep everything from going in and coming out. I work with parents that I remember working with a parent, two young kids, two young couple. They were couple, then they were young. They was drug addicts basically. And I'm not saying anything against that, but they had a 1-year-old and they had a 2-year-old. Okay, back to back. And both of those children had a trach. Both of the children had a trach. So therefore they needed 2 nurses every day. I worked with the 1-year-old, and the one that had the 2-year-old, she had her nurse, okay? Now, my 1-year-old wasn't on the ventilator all day, so I kept this HME over her trach, okay? I kept it on her. The 2-year-old, she had a trach. She was on the ventilator at night, just like her sister. Okay, and she should have had this on. But her nurse wouldn't keep it on her, wouldn't even try to tell her to keep it on her. And she would run around with this here open all the time. And secretions, we call them, just coming out all over her shirt, everywhere. She was always wet with some kind of, would say, secretions. yellow, brown, I don't care what it was just all over her. It was like, stay away, take your child and go over that way and let me and my baby be over here. I mean, she would just, and then she would cough, and when she coughed, there it is, it flies everywhere. But some nurses, hey, anyway, I kept mine on her. Now, another thing too, let me tell you about this HME too. A lot of the kids that have the HME, they can actually cough. We call it productive coughing. And this helps them because if they cough and this is not on it, it flies everywhere. Okay? It goes everywhere. So be careful. And another thing, when you suction your child, your patient, and you got this up and you suction, I don't look directly down on it. I don't. I suction, I stand to the side because I know, and I'm suctioning, but I still kind of stand back. Because sometimes even as you suction, they're coughing, and it could spray. This is what I'm telling you. So still be careful doing that too, okay? Don't just suction and looking right up, right there in his face. No, because they'll just cough, and it's everywhere. It's all in your face. Sometimes they can cough. You see these, this is like a cone. See how it is on the side? On each side. Okay? It looks like almost like a honeycomb on both sides. Okay? So you got this here. I have known children to cough so hard that they blow these out. The honeycomb, it just comes out. Let me see if I can push it out. This one is, I can't push this one out. But I mean, it just be out, laying on the side, because it has so much secretions and everything. So be careful with this here. But this is supposed to be with the children that some kids actually can walk around and play. They might not can actually speak, but they can actually play and stuff like that. The majority of the kids that I've had usually don't do that. I usually get the real critical ones, So, but I want to tell you that, okay? So, this protects anything from going down there. You might have a fly that's going to fly, some insect or whatever like that. So that's why I like to keep that on there. So if they're off the ventilator during the day, they should have an order for an HME, which is this little old thing. And you keep it and you flip it open when she needs suction or whatever like that. And a couple of times during the day too, it can get so much secretions in that you might have to change it out and just put a new one. Throw this one away and put another new one on. Okay, I want to tell you that. Also, I wanted to tell you too, the last time on the first video, I told you when we're changing and putting this the trach in, that you use lubricant. Here, this is the lubricant. It usually comes in something like this here. And this is called lubricant jelly. Okay? And you actually puts it on the tip right here to help it go down into the throat. Okay? Another thing, I told you about the suction catheters. There's two different kinds of suction catheters that you can use. One that is like this. You can change it out maybe 2 or 3 times a week. It all depends, of this one. But that other one, you have to change it out every time you use it. Also, I wanted to show you this too. This is a suction catheter for the mouth. Okay? Because sometimes you need to suction their throat. Or you done brush their teeth and you need to. So this is hooked onto the suction canister. And this here, see that little hole right there? You just put your finger on there, put it in the mouth, and hold it down, and that's suction, and it goes down through this here tubing right here, okay? You can actually suction their mouth with this, also their nose with this. And also, when you're changing their trach, let's go back to the trach for a minute. When you're changing their trach, this is down in their throat, here. If you look sometimes, secretions is coming all around here. It's just coming out, okay? Sometimes they just have so much, you didn't suction them, okay? You don't actually use the suction catheters both. Sometimes you have to go up under that gauze with this here and get the rest of it out and clear it out. Don't put it in the hole, okay? Because you can't really put, you can just put like, let me see. Take this here and just go around up in here and get that the rest of that suction secretions out. And this here is just a covering, because after you're gonna rinse this off here, you're just gonna put it in here. So keep it from falling on the floor and all that kind of stuff, you know. So you can use it a couple of times, maybe the whole shift, all right? Maybe even the next day, depending on how many times you're gonna use it. So I wanted to tell you about that, all right? Let me see if anything else I need to tell you about the suction catheter. That's it. That's it. I want to come back and let you know, just do a second part video about trachs, okay? I hope that helped you. And I wish you all the luck in the world with your career. And thank you for tuning in to Miss D. And I'll be doing another video coming up soon that's going to be about his splints, okay? So just watch, okay? Anyway, you have a good evening, and thank you so much. All right, bye.